All right, for this last section, let's talk about how medicine can look inside the human body and how we can get images of these deep structures that we're talking about. The first one that we're going to talk about, you've all heard of, which is X-ray. The technical term is radiography because it uses radiation to make a picture. Graph means writing, so this is literally writing with radiation. High-powered X-rays are sent through the body. They pass through soft tissues without leaving much of an image, and hard tissues do leave an image. So we can see, for example, a broken fibula in someone's leg here, or a really drastic bunion on someone's foot here. This is not mine. This is. I know, fun, right? So this is a very good way to get an image of hard tissues in the body. It's not good at showing us soft tissues. For that, we need something else. Sonogram, or ultrasound, is a really good way of getting pictures of soft tissues. It uses sound waves penetrating the body, and those sound waves are going to bounce off of hard tissues and soft tissues at different frequencies, bounce back to a receiver that then processes those sound waves into a picture. The great thing about sonography is it is very very inexpensive. It's portable. We now have sonogram machines that are the size of a briefcase, and it does not use harmful radiation. So we know that X-rays are linked to cancer. If you get too many X-rays, it can actually increase your chance of getting cancer. Sonograms are completely non-invasive and totally harmless. Now it does show hard tissues better than soft tissues. So for example, here's two twins in a woman's uterus. Here's one skull, there's the other skull, but you can see the developing brains and structures inside. This is what a normal sonogram looks like. This is a more detailed image that we can get with what's called a 3D sonogram. Still only uses sound waves, more expensive, less portable, but you get these really, really high quality and very, very detailed images. This, by the way, this is not mine, but this is what I saw when I went in for my first ultrasound, not realizing that I was in fact pregnant with twins. So that was a thing. That was an odd way to find out that I was having twins. Computed tomography is another way to use X-rays to get very detailed pictures of a body. It uses low intensity X-rays, much lower intensity than an X-ray, but it shines them over a larger area, and so it's about the same amount of total radiation as an X-ray. So each portion of the body is getting less, but the body as a whole in a CAT scan is getting more. So CT scan, CAT scan. And what it does is it produces dime-thick images of the body along various planes. This, of course, is a transverse plane through the skull. And we can see that not only do we have very clear pictures of the hard tissues, but we also have the soft tissues. You can see the eyes here, the optic nerves traveling from the eyes back to the brain, and then the brain itself. This is what the side of the brain should look like. This is not. That's a tumor, and a CT scan is a very good way to image the inside of the brain because we can't see inside the skull with an X-ray. We can also do CT scans on any plane in the body. So we can do transverse scans through the body, or sagittal, or coronal. So I'm going to play this, and it's going to go through each of these. I'm going to play this, and it's not playing. That's rude. Okay. Well, go look up CT GIF, and hopefully yours will play. Anyway, you can see traveling through the body, different slices of the body. You can get very good images of organs and also other tissues in the body. Now, MRI stands for magnetic resonance imaging. And yes, on the exam, I want you to write out all of these terms, their proper names. Do not give me the initials. That's why the proper terms are bolded. Cool, right? Now you can see an MRI does show us both hard and soft tissues, much more detailed pictures of soft tissues. The downside of an MRI is that it takes a lot longer. A CT scan takes just a few seconds, an MRI takes at least 15 minutes. And it can be very, very difficult to sit still for all of that. The CT scan uses X-rays, the MRI uses a giant magnet, and it's strong and powerful enough to actually momentarily align the protons in every atom in your tissues, which is amazing, but also super cool because we can then dye tissues in the body or look for areas that have more electricity going through them than others, and that gives us an idea of what functional areas of the brain are working at given times. So we can get these images like this that show us that certain parts of the body or certain parts of the brain are not working, where other parts of the brain are working very strongly. So that's a very cool imaging. Now, it is really easy to get CT and MRI mixed up. Computed tomography, remember, uses X-rays. It is radioactive. MRI uses electromagnetic waves, so it is not radioactive. Both of them produce thin sections through the body that then can be put by computer back together to give us a 3D image of a body or an organ or for example, a joint. The CT is better for seeing calcifications. So if we're looking for a growth on a bone or a metal foreign body, say someone has, God forbid, a bullet lodged somewhere in their body, the CT scan can very quickly and non-invasively show us exactly where that bullet is. The MRI gives us better images of soft tissues, but you can't use it if someone has metal in their body because it's a giant magnet, and it will pull that metal out of the body using the shortest possible route, which of course will go through other tissues and organs, damaging them along the way. Also, a note, if you have interesting piercings, make sure that people around you know, and make sure that you have a note in your belongings. If you need to have an MRI and you are not coherent, to tell someone that you have a piercing that could be ripped from your body by the MRI machine, that's gonna be a problem. CTs are very fast. In fact, you hold your breath during a CT, so it's just a few seconds. MRIs, like I said, take about 15 minutes. Now, one of the things that both MRIs and CT scans can't do is show us blood vessels clearly. And sometimes we do need an image of blood vessels. And so the thing that can do that is called digital subtraction angiography, or angiogram, or DSA. Again, I do want you to know this full term. This is going to give us a 3D X-ray of blood vessels, which is very, very vital if, for example, someone is having a heart attack and you need to find out which blood vessel in their heart is blocked, or if you suspect someone has an aneurysm, which is a weakening of an artery that might burst. You can actually see where that weakening is. So what they do is they take an X-ray before and after. They inject you with an opaque fluid. So they take an X-ray, inject you with a fluid, and take another X-ray. Then they put those two X-rays on top of each other, take away the unnecessary stuff, and you are left with this very cool, clear image of the blood vessels. This is an angiogram of the blood vessels on the bottom of the brain. How cool is that? Okay, I think it's cool. And then finally, the last kind of medical imaging that I want you to know about is one that I hope you never need to have, because we We only use it when someone already has cancer and we're trying to determine if that cancer has spread, which is what we call metastasizing or metastatic cancer. So this is a PET scan, a positron emission tomography. Positron emission tomography, or PET scan, uses radioactive sugars, so it is radioactive. And it relies on the fact that cancer cells have a very fast metabolism. They're constantly working because the thing that makes them cancerous is that they are replicating themselves all the time, whereas most cells don't do that. So if we suspect that someone's cancer has spread in their body, then you inject the patient with this radioactive sugar. The cells will take up that sugar as they need the energy, and the cancer cells will take up more sugar than other cells around them. We then do a scan to look at how much sugar cells are taking up, and we can see large areas, for example, where a tumor might be, and then small areas where maybe only a few cells are overusing the sugar, which could be that cancer has spread or metastasized. So our sources of medical imaging: X-rays or radiography. Let's go over these really quickly. Radiography uses X-rays, very good images of hard tissue. Sonography uses sound waves, good images of soft tissue. Neither of those, by the way, can penetrate the skull. Computed tomography, CT or CAT scan, can create a 3D image of the body, uses radiation. There we go. MRI uses a giant magnet. Great for getting images of cells working or of soft tissues. Really great, for example, for a surgeon who's going to do surgery on, say, a ligament in someone's knee. They're going to do an MRI to see exactly what's broken and where it's broken and where it needs to be fixed. MRI takes longer, uses a magnet, can't be used if someone has metal in their body. Better images of soft tissues, CT, X-rays, very short period of time, better for calcifications, for bones, and for metal foreign bodies. Digital subtraction angiography gives us an image of blood vessels. PET scan, positron emission tomography shows us if someone's cancer has metastasized. And that is the end of chapter 1.